The patient has fallen on the floor and has a serious injury and is unable to get up. Therefore, we're going to need equipment to help to provide assistance, and we're going to use a hover jack and mat to provide assistance. We need at least 3 to 4 people to use the equipment. Team, could you come through, please? Hi, Liz. We're just going to assist you to get up off the floor, and we're going to use a hover jack and mat. If anything hurts, can you just raise your hand? If you need assistance from us, just raise your hand. Team, can someone clear the environment, and could you get the hover jack and mat set up? The hover jack and mat will be applied together on top of each other. And then we'll make sure the purple mat is underneath the patient. Liz, we're going to roll you onto your right side. Could you face me? Bring your arms across your chest. And are you able to bend that left knee for me? We're going to give the command, ready, steady, roll. The hover mat is applied underneath the patient. Half of it's rolled underneath. And if you're ready, we're going to let you roll back. And then the other team will help to support Liz onto her side, and we'll bring the remainder of the purple mat underneath the patient. We need to ensure the mat is covering the patient from head to toe, and we have to put the straps into place for safety and make sure there's enough material when the mat is inflated for her to be safe. The team will provide the extension straps to help to assist to slide the purple mat on top of the hover jack, which is in blue. The motor needs to be set up and plugged in. To inflate the hover mat, the purple Velcro strap is released. The hose is placed directly in, making sure you align the metal studs and it's clipped into place. The Velcro strap is then placed over to secure the hose pipe. Then looking at the pump and the motor, you can see that the button, which is purpley green coloured, is inflated to inflate the mat. Everyone ready? Ready, steady, slide. The motor is stopped and we allow the purple mat to deflate. Are you comfortable?
Yes.
And then what we then will do, if you watch closely, the hose will be connected to the mat. To inflate the blue hover jack, the hose pipe is placed directly into valve number 1. The standby button is pressed to inflate, pressing the purple button. Once fully inflated, there should be a pushback of air. Proceed to the second valve. Again, once fully inflated, there is a pushback of air. Valve number 3. Once inflated, you'll feel pressure with a kickback of air. All sections are fully inflated. Press the standby button to turn the air off. I'm going to gently remove the pillow, so when the mat's inflated, there'll be enough support for her head. Is that comfortable, Liz?
Yeah.
And the hover mat and jack can be nicely moved towards the patient. ensuring we're as close as possible. A key point we must remember before we transfer the patient across is to remove the blue strap when you're doing the transfer so the patient doesn't become entangled. The air will be applied onto the hover mat. Our knee will be supported against the jack to keep placement. Our hands are on the mat. The receiving side will have their hands on the pull straps ready to feed across. The patient's head will be diagonal for a transfer first, and then the feet will follow. Ready, steady, slide. Standby button can be used to release. Allow the air to deflate. Remove the straps. Make sure the extension straps are removed before taking the hover mat out from under the patient. Raise the bed to hip height to maintain a good posture. The patient will be rolled onto their right side. Can you face me, Liz? Arms across your chest. And are you able to bend that left knee for me? Hands across hips and shoulders. Ready, steady, roll. Half the mat is rolled underneath the patient. You're just going to be rolled over a bump. Just let your body weight roll back, Liz. We'll reverse the procedure. She'll face the other team. Ready, steady, roll. And the mat will be removed. Once you've completed the transfer with the patient, and while the hover jack is still inflated, you need to ensure that we clean the hover jack and mat and motor for infection control purposes. Then the unit can be disassembled, ensuring that the red caps are deflated one by one with a loud noise. We need to ensure the air is fully deflated from the hover jack. Apply pressure to speed up the deflation process. Align the hover mat on top of the hover jack to keep the equipment together. And we aim to fold to release the air, and the red caps will need to be replaced. Gently rolling and removing the air. When we come to the end and most of the air have been expelled, the red caps need to be replaced from 1 to 4. The motor needs to be placed on the top part of the cart and the hover jack and mat at the bottom, ensuring that the instructions are replaced and the audit form has been completed after use. The cart needs to be replaced onto each truss site where it's appropriate.